gluteal region, or commonly called as buttocks, is unique in man due to upright posture. Boundaries of gluteal region: superior, iliac crest; inferior, gluteal fold; posterior, sacral spines; anterior, imaginary line extending from anterior superior iliac spine to greater trochanter. Cutaneous nerves: from above, lateral cutaneous branch of subcostal nerve, lateral cutaneous branch of iliohypogastric nerve, lateral branches of L1, L2 and L3 spinal nerves. From front, posterior branch of lateral femoral cutaneous nerve. From behind, lateral branches of S1, S2 and S3 spinal nerves. From below, gluteal branches of posterior femoral cutaneous nerve, perforating branches of S2, S3 spinal nerves. Superficial fascia: it is thick and fatty. Subcutaneous fat is more abundant in adult female. This gives the characteristic rounded contour to the buttocks. Deep fascia: it is attached above to the iliac crest and behind to the sacrum. It splits twice to enclose the tensor fasciae latae and gluteus maximus muscles. In between the two muscles, it forms a thickened sheet known as gluteal aponeurosis, which covers the gluteus medius muscle. Laterally, the deep fascia is continuous with the iliotibial tract. Muscles of gluteal region. Muscles of gluteal region are arranged in three layers. Superficial layer: gluteus maximus and tensor fasciae latae are present in superficial layer. Middle or intermediate layer: gluteus medius, Piriformis, Obturator Internals, superior gamelli, inferior gamelli. Quadratus femoris. Origin of hamstring muscles are present in intermediate layer. Deep layer: it consists gluteus minimus, reflected head of rectus femoris and obturator externus tendon. Gluteus maximus: it is the largest and most superficial muscle of gluteal region. Origin: gluteal surface of ilium above and behind the posterior gluteal line. Outer surface of dorsal segment of iliac crest. Posterior layer of thoracolumbar fascia. Gluteal aponeurosis. Dorsal surface of lower half of sacrum and coccyx. Sacrotuberous ligament. Insertion: deep fibers of the lower half of gluteus muscle inserts into the gluteal tuberosity of femur. The remaining fibers forms an aponeurosis and inserts into the upper part of iliotibial tract. Nerve supply. Gluteus maximus is supplied by the inferior gluteal nerve. Actions. Gluteus maximus extends the hip joint during running and climbing the stairs. It is the chief anti-gravity muscle of hip. It regulates the flexion of hip joint during sitting from standing posture. Lateral rotation of hip joint. Maintains the extended position of knee joint through the iliotibial tract. Powerful abductor of hip joint. Structures deep to the gluteus maximus. Bones and ligaments. Ilium. Sacrum. Coccyx. Ischial tuberosity. Greater trochanter. Sacrotuberous ligament. Dorsal sacroiliac ligament. Bursae. Trochanteric bursa between the greater trochanter and gluteus maximus. Gluteofemoral bursa between the vastus lateralis and gluteus maximus. Ischial bursa. Bursa between ischial tuberosity and gluteus maximus. Muscles. Gluteus medius. Gluteus minimus. Piriformis. Obturator Internals. Superior gamellae and inferior gamellae. Quadratus femoris. Origin of hamstring muscles. Obturator externus. Blood vessels and nerves. Above piriformis, superior gluteal vessels and nerves. Below piriformis, sciatic nerve. Note externus. Blood vessels and nerves. Above piriformis, superior gluteal vessels and nerves. Below piriformis, sciatic nerve. Note quadratus femoris. Posterior femoral cutaneous nerve. Inferior gluteal vessels and nerves. Nerve to obturator internals. Internal pudendal vessels. Pudendal nerve. Arterial anastomosis. Trochanteric anastomosis. Cruciate anastomosis. Tensor fasciae latae. Origin. Outer lip of the iliac crest extending from anterior superior iliac spine to iliac tubercle. Insertion. The muscle inserts into the upper part of the iliotibial tract. Nerve supply. Superior gluteal nerve. Action. Abduction of hip joint. Maintains the extended position of knee joint through the iliotibial tract. Gluteus medius. Origin. Gluteus medius arises from the gluteal surface of ilium between the anterior and posterior gluteal line. Few fibers originate from gluteal aponeurosis. Insertion. Gluteus medius is inserted into the lateral surface of the greater trochanter of femur. Nerve supply. Superior gluteal nerve. Actions. Acting from above along with gluteus minimus, it abducts the hip joint. Acting from below along the gluteus minimus, it prevents the unsupported side of the pelvis from sagging downward during locomotion. Medial rotator of hip joint. Gluteus minimus. Origin. Gluteus minimus arises from the gluteal surface of ilium between the anterior and inferior gluteal line. Insertion. Gluteus minimus is inserted into the lateral part of anterior surface of the greater trochanter of femur. Nerve supply. Superior gluteal nerve. Actions. Acting from above along with gluteus medius, it abducts the hip joint. Acting from below along with gluteus medius, it prevents the unsupported side of the pelvis from sagging downward during locomotion. Medial rotator of hip joint. Piriformis. It is the key muscle of gluteal region. Origin. From the front of sacrum by 3 digitations in the form of letter E between the anterior sacral foramina and bone lateral to the foramina. Gluteal surface of ilium near posterior inferior iliac spine. Upper margin of greater sciatic notch. Insertion. The muscle emerges from the greater sciatic foramen and is inserted into the apex of the greater trochanter. Nerve supply. Branches from S1 and S2 nerve in the pelvis. Actions. Lateral rotator and abductor of hip joint. Abduction occurs in flexed position of thigh. Relations of piriformis within the pelvis. Anterior, sacral plexus of nerves, pelvic fascia, rectum. Posterior, sacrum. In the gluteal region. Anterior, dorsal surface of ischium, capsule of hip joint. Posterior, gluteus maximus. Structures emerging above the upper border. Superior gluteal vessels and nerves. Structures emerging below the lower border. Sciatic nerve. Nerve to quadratus femoris. Posterior femoral cutaneous nerve. Inferior gluteal vessels and nerves. Nerve to obturator internals. Internal pudendal vessels. Pudendal nerve. Obturator internals. Origin. The muscle arises from inner surface of obturator membrane, adjoining ischiopubic ramus and upper part of pelvic surface of body of ischium. Insertion. The tendon makes a right-angled bend at the lesser sciatic foramen and appears in the gluteal region. In the gluteal region, the tendon of Obturator Internals is reinforced by superior gemelli and inferior gemelli. This tricipital tendon inserts into the medial surface of the greater trochanter above the trochanteric fossa. Nerve supply. Nerve to Obturator Internals. Actions. Lateral rotator of hip joint. Superior gemellus. Origin. Spine of ischium. Insertion into the upper margin of tendon of Obturator Internals. Nerve supply. Nerve to Obturator Internals. Actions. Lateral rotator of hip joint. Inferior gemellus. Origin. Lower margin of lesser sciatic notch. Insertion into the lower margin of tendon of Obturator Internals. Nerve supply. Nerve to quadratus femoris. Actions. Lateral rotator of hip joint. Quadratus femoris. Origin. The muscle arises from the external surface of ischial tuberosity. Insertion. It inserts into the quadrate tubercle. Nerve supply. Nerve to quadratus femoris. Actions. Lateral rotator of hip joint. Nerves of gluteal region. Superior gluteal nerve. It is formed by the dorsal branches of ventral rami of L4, L5 and S1. It enters the gluteal region by passing above the piriformis muscle. It passes between the gluteus medius and minimus, supplies both the muscles and ends by supplying the tensor fasciae latae. It also provides articular branch to the hip joint. Inferior gluteal nerve. It is formed by the dorsal branches of ventral rami of L5, S1 and S2. It enters the gluteal region by passing below the piriformis muscle. It supplies the gluteus maximus muscle. Nerve to quadratus femoris. It is formed by the ventral branches of ventral rami of L4, L5 and S1. It enters the gluteal region by passing below the piriformis muscle beneath the sciatic nerve. It gives branches to the inferior gemellus and quadratus femoris muscle. It also gives branches to the hip joint. Nerve to Obturator Internals. It is formed by ventral branches of ventral rami of L5, S1 and S2. It appears in the gluteal region by passing below the piriformis muscle. After a short course, it re-enters the pelvis by passing through the lesser sciatic foramen and supplies Obturator Internals and superior gemellus. Posterior femoral cutaneous nerve. It is formed by the dorsal branches of S1, S2 and ventral branches of S2, S3. It enters the gluteal region by passing below the piriformis muscle, superficial to the sciatic nerve. It descends in the back of thigh beneath the fascia lata. It pierces the fascia in the popliteal fossa. It provides gluteal branches, peroneal branches and perforating branches. Sciatic nerve. It is the widest nerve of the body, measuring about 2 centimeters in width. It consists of two components, tibial and common peroneal component. Both the components initially are in the form of a common trunk. Tibial component is formed by ventral branches of ventral rami of L4, L5, S1, S2 and S3. The common peroneal component is formed by dorsal branches of ventral rami of L4, L5, S1 and S2. Sciatic nerve emerges through the greater sciatic foramen below the piriformis. It descends beneath the gluteus maximus. It passes midway between the ischial tuberosity and greater trochanter. It passes on the dorsal surface of body of ischium, tricipital tendon of Obturator Internals, quadratus femoris and adductor magnus. The nerve divides into tibial and common peroneal nerves at the upper angle of popliteal fossa. Branches. Muscular branches to the long head of biceps femoris. Semitendinosus, semimembranosus, and ischial part of adductor magnus. Articular branches to hip joint. Arteries. Superior gluteal artery. It is a branch of posterior division of internal iliac artery. It appears in the gluteal region by passing above the piriformis. It is accompanied by the superior gluteal nerve. The artery divides into superficial and deep branch. The superficial branch passes between the gluteus medius and maximus muscles and supplies both of them. The deep branch passes between the gluteus medius and minimus muscles and divides into upper and lower branches. Upper branch takes part in spinous anastomosis around the anterior superior iliac spine. Lower branch takes part in trochanteric anastomosis. Inferior gluteal artery. It is a branch of anterior division of internal iliac artery. It appears in the gluteal region by passing below the piriformis. It is accompanied by the inferior gluteal nerve. It gives muscular branches to the adjacent muscles, anastomotic branches to cruciate and trochanteric anastomosis, arterial nervi ischia dici, which accompanies the sciatic nerve, cruciate anastomosis. It establishes collateral circulation between the branches of internal iliac artery and profunda femoris artery. It is present close to the root of greater trochanter. It is formed between the quadratus femoris and upper border of adductor magnus. It is formed by transverse branch of medial circumflex femoral artery, transverse branch of lateral circumflex femoral artery, ascending branch of first perforating artery, descending branch of inferior gluteal artery. Trochanteric anastomosis. It is present in the trochanteric fossa. It provides blood to the head of femur. It is formed by descending branch of superior gluteal artery, ascending branches of medial and lateral circumflex femoral artery, branch from inferior gluteal artery.